The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Chances are you or someone you know has arthritis. There are more than 100 different types of arthritis, and the cause of most types is not well known. Scientists are currently studying what roles three major factors play in certain types of arthritis. These include the genetics you inherit from your parents, what happens to you during your life, and how you live. Welcome to Wonderfully Made. I'm your host, Marcel Wiggers. Dr. Milton Teske, an emergency room physician, chairman of the health department at Weimar College, and a frequent lecturer in the New Start programs, will help us understand arthritis. Dr. Teske, what's the good news about arthritis? It seems everyone comes down with it. Is there any hope?
Well, there is hope for arthritis. There's relief for it. And, you know, most people don't really realize how important their skeleton is. You know, they kind of take it for granted that they've got bones, but until you start losing the functioning of your skeleton, being able to move those bones and move your body, you know, one of the characteristics of life is motility. And for the human organism, that means moving your body, moving your skeleton into different positions, moving around. And you really don't think about it, but it's actually extremely important. And when we start to deteriorate the skeleton, start to deteriorate those joints where the various bones move with each other, when they become painful, when any movement becomes painful, it really degrades the life and the way we function. And so today we're going to take some time and talk about the bones and their joints and how they work together and how we can get relief for some of these ailments which affect so many people in such a very debilitating way. So we're going to start out with osteoarthritis. This disease which tends to collapse the spine and make it so that it's really very, very difficult to move well. So we're going to take a look at the anatomy here a little bit. And we're going to start off and take a look at some of the vertebrae that make up the backbone. Now, if you looked at it in a side view, the first part, of course, is that each of these vertebrae has a large, heavy, solid body that stacks on top of each other here. And then behind the vertebrae on the posterior side come out some little pedicles and parts, a little spinous process, and they actually make a little canal and space out here where the bones kind of wrap around and protect your spinal cord that is coming through that area. And we'll maybe just show it coming through here. Spinal cord coming around in between those and protected by the various layers that go over there. But these large bodies right here, this is what supports, makes a column of support, is these vertebral bodies just stack on top of each other. And in between each one of these bodies right here is actually a little cushion. We refer to them as discs. And these little discs that make like little cushions between the vertebrae where you cushion each part with the next one here are actually very important to a well-functioning back. Now these little discs in between the vertebrae, which are made out of bone, the little discs themselves are made out of cartilage. You know what cartilage is? I mean, if you look at it or feel it, it feels almost like plastic. And it's a nice, the ones that come in here are actually a very tough fibrous plastic. If you took out one of these discs and looked at it on end, it's actually round like this, and it's really tough and fibrous ring on the outside, and then a more softer jelly-filled center here. So a very tough outer ring, and then a softer, more jelly-like center. And it makes a nice little spongy cushion between each one of the vertebrae of your backbone, giving strong resiliency to this vertebral column. But one of the characteristics of cartilage is that cartilage does not have any blood vessels. But now it's alive, there's cells in there, so how does it get oxygen and the various nutrients it needs if it doesn't have blood vessels to it? Well, let's explain the blood supply of the vertebral column here a little bit. Now, right in front of the vertebral column, this is the side where your abdomen is, where your intestines and liver and all these things are out here, but right in front of the column, before you get into the internal organs here, the largest artery in your body, the aorta, is passing right down through here. The aorta is that very big vessel that comes right out of the top side of your heart, loops around, and then comes down and passes down. Then when it gets to the bottom of the spine, it divides and makes the two major blood vessels for your legs. So as the blood is coming through this large artery, what we find is there's actually little teeny communicating arteries. These are not major branches, these are little teeny branches that come off at each level of the vertebrae. And these little blood vessels go in and they supply the blood supply here inside of the vertebrae. And they give all of the blood that the vertebral bodies need. And bones, by the way, have very good blood supply. And this blood supply here in the bone not only is enough for the bone, but some of it actually soaks through and absorbs into the cartilage from each side. And that's how these little cartilage discs get their blood supply. They get it from the good blood supply in the bone on each side of it here. And so it soaks in, they get all their nutrients, and you have a nice healthy disc there taking care of that level. Now, probably one of the most devastating diseases to affect Americans today is this disease we call atherosclerosis, hardening of the arteries. You know, that's that same disease that causes heart attacks when it gets to one of the arteries in your heart, causes a stroke if it gets one of the blood vessels in your brain. More people die from that than from any other cause in the U.S. But that vessel disease starts first not in your heart or your brain, but actually in this largest of all vessels, your aorta. And what happens is it starts to build up a little teeny layer of atherosclerosis along the linings of the artery wall here. Now, that little teeny that's going in there is not enough to really affect the major flow through the aorta to your legs for decades. There's really not much problem because it's such a it's the largest artery in your body. But one of the problems we do notice is that right here, as it starts to build up, remember these little teeny arteries that come off here? Well, a lot of times the little opening to those gets narrowed and plugged up very soon. And this, as this gets plugged up, what's happening here behind it? Well, now we have a decreased blood flow back here. And this bone is not as healthy as it would be otherwise. And as the bone gets weaker and weaker, the health of the bone cuts down and down, we notice a number of things that can start to happen right here. One of them is, of course, is the bone can actually get so weakened that even a minor injury and the bone actually just crushes or collapses. And we sometimes get collapsed vertebrae here, where the whole vertebrae just collapses down to a little narrow wedge like that. And of course, this is part of the reason for the shortening in height. As osteoarthritis sets in and aging, we get this shortening of the vertebral column, and we're not as tall as we used to be. Sometimes as it wedges, we also tend to hunch forward and bend forward farther. And this hunching forward and shortening of the vertebral column as we start to collapse some of the vertebral bodies in here. But another thing that happens, sometimes even before we start collapsing vertebral bodies, remember these discs in here? They get their blood supply from where? Yeah, you remember. From the vertebral bodies. Now, if we've cut off and don't have a good enough blood supply here, are they getting a good enough blood supply? No, they're not. They're starting to get weaker. And as we start to weaken out the disc right there, the cartilage disc, particularly this outer fibrous ring around here that kind of holds the jelly-like center in, Sometimes it gets so weak that it can be easily ruptured. And sometimes, you know, we're doing heavy lifting or straining and it ruptures. But if it gets weak enough, it doesn't take some of that. It can be as simple as bending over to pick up a paper clip. Yeah, as simple as that. Oh, and it says, I threw my back out. What happened right here? You actually burst through this fibrous ring right here. And as it burst through, this jelly-like center just kind of bulged out here. And this bulging disc is what we refer to as a herniated disc. And of course, if that happens up here, what happens if it bulges out back here where the spinal cord or some of the nerves were? Do you see how it would be pressing against the nerves right there? And we often talk about a pinched nerve and get severe pain shooting down into the legs. It can become, a herniated disc can become a very debilitating disease. And, you know, we go an MRI scan and take a look, and we try to go in there and, you know, cut back some of the damage there, open up here, fuse some of the vertebrae together, various things to try to stabilize the situation there so it doesn't get further bulged out, press on the nervous column further, and do further nerve damage. But really a very devastating disease process right here. And we often don't think about it when we think about arthritis of the spine, that the underlying disease is not the herniated disc or the collapsed vertebral body, but what is it? Yeah, it's right here. It's that same atherosclerotic disease that causes heart attacks and strokes. Of course, we can get a back problem, you know, a decade or two before we're going to end up starting getting angina or a heart attack. So, you know, if you're having problems there, it can also be a sign that you're moving down that road towards a heart attack in the future. And of course, what is the answer to this? And we've talked about this in a lot of the other programs, but to summarize it real simply, how do you reverse atherosclerosis and open up those blood vessels and get a blood supply back there to stabilize and get the health back into your spine? Well, the diet, whole plant foods eaten whole. That simple whole plant food diet is the key that is going to turn this around for you and get back right. And in addition to the diet, what is it? Walk, 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 walk. Yeah. Exercise is going to strengthen the arteries and move this thing in the right direction. So the whole plants eaten whole and walk, 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 you put those together, you know, we've shown that the arteries open up, that this reverses. We've had people with significant degenerative disease there in the spine come to Weimar Institute's lifestyle program. They go through the treatment program there, and they can get the pain goes away, they get the strength back, and they can get a nice strong back again, so they can walk around and carry some heavy weights and carry on life normally without the severe debility that comes from the broken down spine there. Now, beyond breaking down the vertebrae there, we damage the bones of our body in another way. One of those we talk about is osteoporosis. And we don't have a lot of time to cover everything about osteoporosis, but you know, probably when most people talk about osteoporosis or thinning of the bones, first thing they say is what? Calcium. Yeah, you need more calcium. It's time to drink some more milk, right? Did you know that milk drinking is probably the worst thing you can do for your bones? Did you know that we only find osteoporosis in countries where people drink milk? Yeah, it's very fascinating. You know, we can do this study where we actually take and plot the incidence of osteoporosis found in the population of that country, and then plot that against the per capita consumption of dairy products. And you know what we find? A direct correlation. You know, there are some third world countries that have virtually no access to dairy products. The common people just do not drink milk. It's not available to them. And you know what we find? No osteoporosis at all. But as the per capita consumption of dairy products increases in the country, so does the incidence of osteoporosis and thinning of the bones. Until we get to countries like the U.S. that have very high per capita consumption of dairy products, you know what we find? Yeah, virtually everybody's got osteoporosis at this point. The highest countries in the world are like Finland and Denmark, the Scandinavian countries. They have the highest consumption of dairy products, and they have the highest incidence of osteoporosis. I mean, in the emergency department when I work, I regularly expect when I put up an x-ray of an elderly person that the bones are thinned out. And in most cases, the bones are so thin, there's just a faint little shadow of the bone left there. The calcium's almost completely gone from those bones. One day I had a very interesting episode. They had brought in this little lady. It was a little Japanese lady, and she didn't speak English. Her daughter brought her in. She had fallen down to get some x-rays. But as I picked up the chart to go see this patient, the chart jumped out, because up at the top there's the demographic information, the name, the age, and all that stuff, and the age was 102. Now, I don't see too many patients that have more than 100 years of age. But here was this little lady, 102 years old. And so we went and we got the x-rays of where she had fallen, everywhere that hurt. And as I got the x-rays and put them up on the view box to look at them, I was shocked. Her bones were as dense and hard and white and solid as a teenager. She had absolutely not a trace of osteoporosis at 102 years of age. And as I looked at that, I was amazed. At 102, she had no osteoporosis at all. Of course, I couldn't help asking her daughter, who was translating for her, what is the, what do you feed her? I mean, what is she eating? What is her lifestyle that she has no osteoporosis at all? Because I was showing her the x-rays. And by the way, she didn't break any bones. She was fine. She was just a little bit bruised up. Well, she says, oh, you know, I can't get her to eat anything. All she wants is her rice and vegetables. Yeah, she wouldn't eat any of the American food, all of our meats and cheese. All she wanted was her rice and vegetables, you know, and a lifestyle of that simple plant-based diet, and she had no osteoporosis at all at 102 years of age. So if you want strong bones, don't drink your milk. Eat your veggies. That's the key to really good, healthy bones. Now, another form of arthritis, which really affects in a very devastating way many people, is something we call rheumatoid arthritis. You know what rheumatoid arthritis is? It's actually in a class of diseases we call the autoimmune diseases. What does that mean? That means your body's immune system is actually attacking you, and in this case, attacking the joints. And what is happening here is the body's immune system is actually coming in and creating an inflammatory reaction and attacking and destroying that joint. Now, at Weimar Institute's lifestyle programs, where we treat people with lifestyle diseases, we've been amazed at the benefit and the results, the improvement that people are suffering from very severe arthritis get when they come through the program. Many of them come with very debilitating pain in the joints. We had one individual come, she was totally bound up in a wheelchair because of her arthritis. The pain was so bad, she was on high doses of codeine. She'd not only been through all of the non-steroidal anti-inflammatory drugs you're probably familiar with, Motrin and Celebrex and all of those type of drugs. She had been on steroids. She'd been on high doses of steroids. She'd been on methotrexate therapy, gold therapy. You know, some of these very, very powerfully damaging things, trying in some way to suppress this overactive immune system that was attacking and destroying her joints. And she was totally incapacitated by this. She stayed at the Weimar Institute's lifestyle program for a couple of sessions there, and during that time, she got to the point where she could actually move a little bit around the flagpole a few steps. What was she doing every day? Eating a simple plant-based diet, the same diet that the Creator gave us, whole plant foods eaten whole, fruits, vegetables, and grains, no dairy products, no added oils, no meat products. And on this simple diet, she could start moving her joints, start exercising. We got some hydrotherapy treatments for her. And by the end of several weeks, she was not only walking around this little loop around the flagpole, but she started to walk on some of the other doors. And as she walked around some of the other roads here in different places, she got stronger and the joints got better. The pain went away. She was getting off of the codeine. And by the time she had been there for a couple of sessions, she was walking over 3 miles every day, completely pain-free without any medications. And we see a similar type of approach in many of the patients that come through there. One thing very interesting that Dr. Crane, he is an endocrinology specialist there at Weimar Institute, has been there many years. An observation he has noticed in the guests that come through there And I want to share this with you because I want you to understand some of the mechanism that we believe is going on here in this particular disease process. And that is that he noticed two factors in particular, dairy products and refined oils. If we eliminated those completely from the diet, as of course we do there at the New Start cafeteria, the patients do well, and as long as they're there at the New Start program, they seem to do fine. But when they go home, if they cheat just a little bit on the diet, they're starting to put a little bit of cream back in something, adding a little bit of oil to something, a few of those things are creeping back into the diet, for some reason the disease process comes back and the pain and inflammation starts to come back to the joints. And apparently it takes only a very small amount of these substances to actually come back and affect the body in a negative way with some of these autoimmune diseases, which is a little different than some of the other disease process. If you've got diabetes or high blood pressure, if you follow this diet 80% of the way or 90% of the way, well, you'll get 80% results or 90% results. Of course, you'd like to go 100% and get 100% results, but you can follow it most of the way and still get some fairly good results. But for some reason with arthritis, that's not true. You've really got to go 100% all the way. And as we find that people stick on the 100%, the inflammation and stuff completely clears up, goes away. We notice something very similar with some of the other patients with various autoimmune diseases. Beyond rheumatoid arthritis, multiple sclerosis, of course that's 1,000 different things, but many forms of multiple sclerosis are autoimmune. There's lupus, scleroderma, psoriasis, and lots of other diseases where the body's immune system is attacking various parts of the body. And interestingly, we have found that all of these autoimmune diseases seem to respond quite well to simply coming back and eating this whole plant food diet. The same diet that God gave to Adam and Eve in the Garden of Eden, and the same diet we expect to eat in heaven throughout eternity, is still the best diet for planet Earth. And we've had really some amazing people get really good improvement. One young girl, she was about 18 years old. She had a case, one of the worst cases of psoriasis we've ever seen. She not only had those thick scaly patches on her elbows, but they had spread over much of her body. Her whole face was one crusted mess. It was just a devastating disease to her appearance. She had been to all of the therapy. I mean, she had been on methotrexate, she had been on tar therapy, ultraviolet, she had been on, every possible drug and regimen they could try. And she still was just, she had been to Stanford as well as the local hospitals. She tried everything, and there was really seemed to be no relief for her severe, devastating disease. She came up to Weimar Institute's lifestyle programs, and she went through one session lasting about 3 weeks. And during this first 3 weeks, she really did not have much significant improvement. She still had all the thick scaly patches and stuff. But they're impressed. It just urged her to try and go a little bit longer with it. And so she stayed for a second session, stretching it out to about 6 weeks, her time there. And by the time she had come to about 6 weeks, everyone was just amazed at the turnaround. By that time, the scaliness had disappeared, and she had normal, smooth, pink skin again. The psoriasis symptoms were gone. And she was just the happiest girl you've ever seen. Can you imagine to give a young girl her face back again? These autoimmune diseases that can be so devastating in some ways, any of you that are listening that are suffering from it know what I'm talking about. The scleroderma, the lupus, they affect you in so many ways. But to realize that there can be relief. They really don't have to keep on going, destroying your body. There is a way to get back in control of your body. And it's through actually putting the right foods into your body. And as I shared with you, particularly, we want to eliminate dairy products and refined oils. When it comes to refined oils, what am I talking about? If it comes in a bottle, we don't use it. It doesn't mean it's a fat-free diet, of course, right? No, we still include almonds and walnuts and avocados and soybeans. And so there's many important ways of getting essential fatty acids into the diet. They're necessary for health. One of the things that fatty acids in the diet are used for is making little communicator molecules in your body's immune system. These are the things we believe is giving the key right here, and it's because the fatty acid molecules, by the time we refine an oil and end it up in a bottle, it's not the same as in that same substance it came from. The oil in eating corn is not the same as the oil that's in the bottle of corn oil. Not only are you getting more of it, but it's damaged, it's altered, it's twisted, it's in a different shape. And because when they come out, they get heated, they get exposed to the air, they change their shape. And when they change their shape, they don't work the system, because the body uses those fatty acids to make important little communicator messages between cells of the body's immune system. And those little important communicator messages now are not going to work right. They send the wrong message. And instead of saying retreat, they send you a message that says attack. And the harder you try to say retreat, the louder the body says attack. And the more we use these oils and dairy products and these altered fats in our diet, the more we set ourselves up for confused communication between the immune system cells. And it's this confused communication in the immune system that apparently seems to be responsible for this out-of-control attacks against the body. And so how do we get rid of that, of course? Again, by completely eliminating those, and so that the only fatty acids in the diet that come in the form of eating an almond or eating a walnut or eating an olive or an avocado. Then they're the perfectly shaped fatty acid molecule that can go into the cell, and when it wants to say the retreat message, it can make it. It can twist it into just the right shape and make it perfectly. And so it can send the right message to your cells to calm down the attack, settle down. We're not at war with the joints here, so let's stop attacking them. I mean, is that the message you'd like to send to your joints? Well, the way to do it is you've got to give the right foods to your body's cells, and that comes from eating right. So now you have the keys right here. We've talked about the osteoarthritis and all of the things that affect that. We've talked about the autoimmune diseases, and it all comes down to trusting God, trusting that the diet that He created for the human race is the correct diet to eat. And as we go ahead and eat this diet, taking the foods the way God designed them, our body is going to be able to make those correct communicator molecules. So every single cell in our body can talk to the other cells correctly, and we can have the best health that we're supposed to have. And as we eat those foods and walk, and get the sunlight, the fresh air, and trust in God, we will end up having that health that God wants us to have. We'll be able to use our skeleton, use our joints, go outside and walk in the peace and the joy and the love that God meant us to have.